skills so that you can experience and enjoy the athletic career that you desire. Host, Dr. Mike Matthews. Hey everybody, welcome to episode 24 of the Athletic Potential Podcast. Appreciate you being here, and we are going to jump right in, but let's get started a little bit with an intro. Every episode we start with a case study. It's typically the last patient I treated prior to the recording of this episode. Then we jump into some questions from the audience, and then we finish with a general summary and recap. I just want to first say thanks to everybody that's been listening to the podcast. We're creeping up on 25 episodes, which is always exciting to start hitting some of these milestone numbers. So episode 25 is coming up next, which we're really excited for as well. But I just want to say thanks to everybody. So, all right, let's jump into our case today. We're going to be talking about a javelin thrower. So this athlete came into me as 20-year-old female javelin thrower who's been having some recurrent shoulder pain over the past, I would say 2 to 3 months. She can definitely go back and tell me when her pain started. It was during a meet, not during a meet, but during a practice. And she was just throwing the javelin, and she had thrown the javelin a little bit more than she normally does, and she started to feel some achiness in the shoulder. And what happened is she felt a substantial increase in sharp pain, mainly in the front aspect of her shoulder here. And then was unable to continue to throw after that because the pain persisted. She then took about 5 to 6 days off, went back to throwing with a lighter javelin, and was able to do so fairly successfully, but was still kind of having some pain. And then she went and then saw another clinician, was treated for around 4 weeks, shoulder strengthening, some range of motion, good things that seemed to help her. And she started to return in regards to her javelin throwing again, and she noticed that the pain returned. She kind of fought it for a long while after that, and then just more recently ended up in our facility, mainly because she went to go out and throw as hard as she could, and she noticed two things. One, that her pain levels were continually high, higher than she wanted. They weren't to the point where she couldn't throw through them. We're talking like a 4 on a 10 scale of pain. But what she noticed is that her distances of throwing were significantly less. And so she's noticed some substantial decreases in her performance. So she came to us to try and understand maybe what she could do better or maybe what's going on. And I can tell you, an initial examination, she actually looked quite good. The things were normal. Shoulder range of motion was pretty good for a javelin thrower. She had maybe a slight loss of external rotation in her shoulder, which doesn't allow her to get into the better positions. However, when we looked at her in regards to her throwing motion, she seemed to get into all the positions just fine. Now, one thing that we noticed almost immediately in regards to her was she's fairly tall. She's 5'11", and she's got a pretty good wingspan. And we noticed that generally, muscle build wise, she didn't really look like a thrower. Like, she didn't look like she had like more stout shoulders. She looked fairly thin. She didn't have a lot of muscle mass to her. Her lower half, the same thing. Not that there's a specific javelin built. However, we would expect certain muscles to have a little bit more hypertrophy, a little bit more size. And in her, they just weren't there. And so we went and kind of looked at strength numbers. Her strength numbers were substantially low, which was a little bit surprising considering that she had done 4 to 6 weeks of physical therapy, which did include a lot of shoulder strengthening exercises. She did take about a month and a half off between the last therapy session and then seeing us, but she did say that she had continued to do her exercises, and we just hadn't seen a major change. And we didn't see a major change in her strength numbers. Her strength numbers actually seemed to like maybe they were less. Now, we don't know if they were stronger than her last therapy appointment. I was just a little bit shocked to see her numbers as low as they were. And so that was our primary concern. As I said, look, your shoulder range of motion looks good. Your positioning looks good. Your posture looks good. Shoulder blade could be a lot better, but to be honest, it wasn't something that I was like, oh yeah, this is your issue. And I just said, look, strength is your problem. We need to get you stronger. And so we started strengthening her and doing some very specific strengthening exercises targeting specific muscles. We decided to decrease her throwing volume by about 50%, which decreased her pain volume by half. So she was having about 4 or 5 on a 10 scale with throwing, a normal weight javelin for her. And she was able to go down to like a 2 on a 10 scale by decreasing her throwing volume by 50%. which really wasn't that large, to be honest. Equated to around 10 to 15 throws, which, depending on school of thoughts in javelin, that may not be very many, or that may be a tremendous amount of throws. It just seems like there's a lot of different variances of how coaches coach this. So we decreased it by 50%, substantial decreases in her pain, just basically indicating that the irritability in her shoulder was still there, and we needed to decrease that. We started strengthening exercises, and we used essentially a twofold approach. We wanted to make sure that the tissues in her shoulder that were irritable, mainly her rotator cuff tendons, supraspinatus, subscapularis, and she also had a little bit of pec minor tenderness, and then she had some levator stuff, muscles on the back attached to the shoulder blade. And so we did some dry needling on those, as well as some soft tissue techniques, release techniques, which really seemed to help free up her shoulder and allow her to move with less overall pain. However, her strength numbers were still considerably low, and so we continued to work on strength for a few weeks. We saw improvements in her strength numbers, but no real improvements in her pain. And so I started to wonder, okay, strength numbers are coming up, movement quality is up, posture is up. Is something else that we really targeted was posture with her. She was 5'11", and she had a little bit of a slump posture, and we were able to rectify that. Especially when she was throwing, we saw improvements in her posture there. So all these things seem to improve, but her strength numbers were continually still low, and her pain it just didn't go away. So we persisted. We just continued with strengthening. We added different things. We were doing rhythmic stabilizations, trying to work on dynamic stability. We had her doing blood flow restriction training protocols 3 times a week, both in clinic or in facility with us, but also at home. And we started to see strength numbers continue to improve again and again, and her pain level stayed the same. So we're about 4 weeks into it at this point, and we were just wondering if there was something in regards to the shoulder itself that was the problem. Maybe there's a soft tissue problem, maybe there's a tendon problem, labrum or something. We continually tested this for 4 weeks, and nothing showed up on testing. She had no imaging of her shoulder, so we really didn't know what was going on in there, but at the same time, nothing that we tested indicated that she really needed to have further imaging, except for the fact that her pain levels continued. So at about 4.5 weeks, I kind of decided that, look, we need to see some substantial changes in your pain, and so we're going to change a few things up. So we went away from this traditional strength training program, and we started putting in her positions of throwing and making her do essentially isometric holds in different directions. And so the way to think about this is, imagine you're in a javelin throwing position. You can Google that, what it looks like, arm laid back, body turned slightly. And what we did is we had her hold onto a pole that had eyelets on each end. So imagine 2 loops attached to about a 2-foot pole. It didn't weigh very much. And what we did is we attached bands or a cable column to that pole, and we had her get into those positions, and we had her then rotate through her spine and her lower half, and just had her stabilize her shoulder against her body moving. And we had her do this for about 2 weeks, and what we've noticed ever since is that her pain levels have substantially decreased. And the reason I believe that this happened, and the reason why I think we were successful in switching to this program, was she had enough strength that would be considered strong enough. She had enough core strength and posture that indicated that she should be okay. And she demonstrated good shoulder blade position and good ability to get into certain shoulder blade positions without a problem. She was able to get into positions of throwing just problem. The issue was she was unable to dynamically stabilize her spine and shoulder blade together in the motion, which then decreased her ability to activate and to use her rotator cuff most effectively. And so when we actually trained her to maintain rotator cuff stability, but then did so as she was moving her core, and think the drill is maybe hard to kind of understand, but essentially we have them in that throwing position, and I would say, look, your sternum never changes position. You have a laser pointer shooting out from your sternum, and it's pointed at a target across the wall. I want you to keep it there, and I want you to just rotate your lower half. Your belly button is going to go away from that same point. It's going to start looking to the left. She's a right-hand thrower. And we had her stabilize up top, rotate down below, and then we switched it. And then we said, okay, now belly button's facing straight ahead. Now you're going to rotate that thoracic spine and try to get it to point the other direction. And by doing that, but under load from the shoulder in different directions, I think we were actually able to teach her to better include the kinetic chain in her throwing position And what ended up happening was we saw substantial decreases in her pain, and we also saw a substantial improvement in her throwing distances. Now, she was not back up to where she was before at that point, and so we basically said, look, you got to get back into your practice. We sent her to a very good coach. She was kind of self-coaching at that point and had some coaches here and there that she would meet up with here and there, but we got her a little bit better coach. And as of right now, we haven't seen full results yet. She's still in the training program, but her distances have improved. She's back almost to where she was previously, no pain. And to be honest, I think the report was, hey, I feel good. My arm feels good. My shoulder feels good. Everything feels good. And I'm throwing at 80% of what I normally feel like, and I'm hitting my PR numbers right now. So 80% effort, PR numbers around the corner, like she's right there. I think we've kind of improved a few things in regards to her care. So something to take away from this case is that you may test really well at everything, but the body is one piece. As a phrase that I take from Dan John. Most of you guys, if you listen to the podcast, I'm heavily influenced by Dan John's principles and training principles, but he talks about the body being one piece, and I absolutely believe it. We can train it in segments, shoulder strength and core strength and scapular strength and movement and everything like that. But unless we can then put them all together and teach them to work in harmony, we're just not going to see the results we want to see. And that applies to almost any athlete in any sport, or even just general movement for anybody that is just walking around. So fun case. It's been fun to see the improvements, and it was there's an interesting case in the fact that we saw every indication that she should be pain-free. And we even went down some roads of like, maybe we're just not seeing stuff, that maybe tissues are just degenerative, or it's probably the wrong way to work, but they were just overly sensitive to any stress. And we were even looking at biologics, maybe at this point, like PRP injections and other things to maybe try and improve. And we didn't go there because we weren't ready yet. And then that's when we tried the kinetic linkages, I think what we called it eventually. We'll probably change that name, but that's okay. It definitely was kind of fun to see it all come together and to see her improving. And so we'll kind of keep track of her, and hopefully we'll see some good numbers out of her. And she should throw pretty far, so it should be kind of fun to see where she ends up. So, but fun case. So, all right, well, let's jump into our questions from our audience at this point. Our first question comes from Lindsay, and Lindsay says, my daughter plays high school softball as well as club softball. As a parent, I feel like I've been seeing more players not playing due to low back pain than I have seen in the past. What exercises should be done to help prevent low back pain in softballers? Lindsay, so when we talk about low back pain in softball players, it would help to have a little bit more information, but we'll discuss both. So more information meaning we're assuming that this is age ranges anywhere from 15 up to 18, just because high school and then maybe club we can go a little higher. But the idea is around 15 to 18 years old. We don't know if these are position players or pitchers that are out. We'll assume that they're both. We'll have a fair amount of low back pain in softballers, whether it's pitchers or position players. We've seen it in the research that the number one injury in softballers, according to the research, this is collegiate data, not high school data, but collegiate data. Number one is shoulder. Number two is lower back. And then there's a smattering of things other than that. And I would definitely argue that hamstrings in there. I think it should be rated higher than what the research is saying, but just because of the way they collected the research, they body segmented it rather than muscles and those type of things. And so there's some conflicting data on whether or not it's a hamstrings, a knee injury, or a hip injury. So anyways, but I'm willing to bet hamstrings is up there. It's probably just almost as high as low back pain. But low back pain was number two in the study that I'm referring to. So we know that it exists. We know it exists in position players and pitchers and softballers. And typically it occurs when we talk about low back pain, it's occurring at the levels L4, L5, and L5S1. That's the very lowest part of the lower back before it becomes the sacrum and tailbone. And typically these are extension bias, so arching the back. Think anything that creates a big arch in the back, not rounded forward, but kind of that big chest arching back, because the swing has extension in the lumbar spine, the throw overhand throw has extension of the lumbar spine, and then we know that even the pitching motion with the windmill pitch coming through, there's an extension moment there as they plant their front foot, as well as some other phases of the throwing motion. So we're just going to assume, Lindsay, that we're talking about lower back pain that's extension biased, arching the lower back, and that we're seeing more. You're seeing more injuries than you have in the past. Now, I don't have research as to maybe why this is. There's no causative research there or anything like that. But what we can do is I can tell you what I found here at Athletic Potential. We've had the opportunity to screen a fairly large amount of softballers now, all the way from high schoolers up to collegiate level. And I can tell you there's one common theme that I'm starting to see. Now, this doesn't just exist in softballers. It does exist in baseball players as well. So there's some correlation here. Softballers have there's a little bit different here, but we'll stick with softballers. But know if you're listening and you have a baseball player, you're a baseball player, that some of these concepts hold true into baseball as well. So what we found is in our screenings, we're probably talking about probably around 100 softball athletes in the high school to collegiate realm now. And what we found is that I would argue to say nearly 50% of these athletes have two things happen in regards to the lower back. One, either in standing posture, they're in an anterior tilt. So imagine your pelvis is like a bucket. So if I'm standing and I'm standing in normal and my front's facing the camera here, or front's facing forward, if I tilt the bucket forward and I pour water out the front, that's anterior, that's forward. My pelvis is tilted forward, anterior pelvic tilt. If it's going the other way, pouring the water out the back, that's posterior pelvic tilt. And what we found is that I would say close to 50% of our athletes, either in a standing posture, have an anterior pelvic tilt, or when they go to move, specifically arms up overhead or arms away from their body, they end up having an anterior pelvic tilt that happens. So if you think about throwing overhand, we're in an anterior pelvic tilt, and if they're going to swing, their arms maybe go behind them as they go to take that swing, and they go to rotate. Well, those hands lag back, and that's going away from the body, and so we see an anterior pelvic tilt there. And so we see these issues and these injuries in these players because of excessive extension or arching of the back in high velocities with rotation. And there's a couple things that we know about the lower back. One, if you look at how much rotation actually happens in our lumbar spine, that's the lowest level of our spine, so L1 to L5, so just above the tailbone and just right around where the ribs stop, that's kind of our lumbar spine. And what we know is that if you take total range of motion, that means from one side, so left all the way to right, we're talking anywhere in different studies are looking anywhere from 13 total degrees all the way up to maybe like 25 to 26. There's some other research that does indicate that there's more range of motion, but if you look at the data and how they measured, I argue that they probably are creeping into the thoracic spine and seeing more rotation. The lumbar spine is not built to rotate. It's the way the joints are lined up, they're back to back, but it's not built to rotate. And so we're asking the lower back to rotate. There's rotation force there, but then we're also extending at the same time. And when that happens, you get stress to the bones, the vertebrae in your lower back and the lumbar spine. And you do it enough times that you create stress reactions or stress fractures, or even to the point where you see substantial fractures that actually occur. And this is something that does happen quite frequently. You see it in baseball players as well, but softballers experience this. And I can tell you this, that we have screened probably 3 times as many baseball players and softball players, and the baseball players still have anterior pelvic tilts, but probably not at quite the frequency that I've seen in our softballers. Now we have a fairly low softball screening size right now. We just don't have great numbers yet, so I may be totally off on this, and I'll have to go see if there's more research out there, and I apologize if there is, saying that there's way more anterior pelvic tilt in baseball players. We know it exists, but I can tell you from just what we've seen in our data, we're seeing that the softballers may not be always an anterior pelvic tilt, but they have a difficulty controlling it. And so I can tell you right now, you kind of asked, like, what exercises? I can tell you right now, anterior core exercises, we're talking abs and obliques, are the way to go. Now, this is where I think most people get it wrong. And that is, the minute I say anterior core or abs, everybody goes, oh, let's do crunches. Let's do sit-ups. Let's do side crunches. Let's do Russian twists. Nothing against Russian. All these exercises are good in their own way, but again, whenever I talk about exercises, whether good or bad, I always talk about in context of cost benefit ratio. And then the other things that I always talk about is specificity. Does it actually transfer? Does it go to what we want it to control? Right? Now, when we're pitching and hitting, we're not flexing in our spine. We're controlling extension. You're teaching the spine not to go arching. You don't want it to go all the time. So we're teaching the body, the abs and the obliques, to control how much arch of our lower back happens during those activities. And so in my opinion, if you're out there doing crunches and sit-ups and these type of things that arguably actually aren't very good for the lower back, I would argue that that's probably not the best way to train it. Now, more strength in the abs and the obliques has been found in research studies, non-specific to softballers and baseballers, to improve the ability to maintain or to control the lumbar spine. That makes a lot of sense. If you don't do anything, you're going to be not as likely to be able to control your lumbar spine as if you do something. However, when we start talking about rotational athletes such as baseball and softball players, and we're more specific to this question, we're talking about softballers, you've got to train the core, the abs, the obliques, and there's a whole slew of other muscles we're not even talking about right now that have to be trained specifically to that sport, especially at the higher levels. And we're talking about softball in high school and club right now on this question, but we'll also talk about, because we have data on collegiate level, right? The highest levels we're going to see. And what we've noticed is we have to train it the right way. If we don't train it the right way, there's no transfer and we still have issues. And so what I would tell you, Lindsay, is this, is if you want to know where to start, the first thing you need to be able to do is show one normal standing posture in an upright position. So literally just stand up, have your daughter or whoever's we're working with here, have them stand and see if they're in a neutral position. You can look at this a little bit and see based on their pant line, is it more flat, is it more tilted? Pant lines aren't perfect because there's, they can move around, and depending on how the girls wear the pants, up high, down low, it just depends. However, if you can find a way to measure that or see that, and if they're already in anterior pelvic tilt, and in this age group, I'm willing to bet they're going to have a really difficult time maintaining that position, if not it'll be worse when they actually go to throw, hit, or pitch. And so that would be the first thing to say, is like teach them standing posture and where they should be, and just teach them posterior pelvic tilt if they have an anterior one. There's a lot of YouTube videos you can look at that and try to do it that way. I always say the same thing with this. Find somebody who knows what they're talking about and can help you, and it's worth getting the coaching on this. These injuries are prevalent enough that it's worth getting coaching on. So maybe that would be the way to do it. I can tell you the girls softball teams that we screen, we have a specific screening process that would then leads to exercise prescription that's more on an individual basis or a classification-based system. And we build exercise programs specifically how do they screen. And when we see those things, they're doing very, very specific exercises to maintain pelvic position. It is arguably one of the biggest things that we can do. The most beneficial thing we can do for these athletes is teach them how to maintain the proper pelvic position. So yeah, sorry, I got a little bit on a tangent with this, but the idea is, Lindsay, start with the standing posturing, make sure that's good, and then next thing I would do is they need to maintain that same standing posture but in a plank position. So think push up on hands position, okay, and they need to be able to maintain that same pelvic position, but now with gravity pulling down through their spine, not stacked on their spine. If they cannot maintain that, that's where you start. And you keep drilling it, Sorry. You keep drilling it until they get it. And that may take months for that to actually happen. There's nothing wrong with that, but just stay with it, stay on them, and make sure that they understand that proper positioning. So from there, there's an absolute slew of exercises you can do. If you go to Athletic Potential on YouTube, look up those different exercises, you'll see a lot of things that say tall kneeling. Tall kneeling is my preferred position. Once they have demonstrated that they can be able to get in the right positions and standing, then I like to go to tall kneeling, because now it takes the knees out of it and it makes it a lot more difficult for them to cheat and compensate, because now they don't have any way to do it. They have to show proper positioning of the pelvis. So that would be my next thing to tell you, is maybe to look at some of the tall kneeling stuff. So you can get on our YouTube channel and just look at those things. Those videos are on there, they're free. So take a look and see if that helps. That's where I'd start. But I definitely would say if your club team or high school team is seeing substantially more injuries, this is a problem, and you need to address it because these girls will not get back quickly. Once you have a full-blown pars or a stress fracture in the lower back, it is essentially a shutdown for a while. I mean, we're talking about bone, right? We talk about how long things take to heal. And what we found is that they've got to heal according to the tissue that's involved. And we know that bone takes around 4 to 6 weeks. And I probably inch more towards the 6-week mark in the spine. So just know that that's the case and that they're going to need to take substantial times off if this is not addressed soon enough. So, Lindsay, I appreciate the question. This is something we've absolutely been working heavily with in the past couple of weeks. So if I feel like it went on a little bit of a tangent, I kind of did, but that's because it's something that we've been working very hard and a lot of our different athletes right now, specifically our softball athletes. We've seen it a lot more. We've been programming a lot more. And I can tell you right now, we're not out there yet. They're not out performing yet, but just right now with the data we have, we're seeing improvements not only in pain reduction in those that have had pain, but we're seeing improvements in performance measures on the field. We're talking exit velocities, we're talking velocities, we're talking the ability, just watching girls hit, watching girls throw, and the way they move. We've seen improvements already. So this is a great way to really, if you can do anything, this is where I would start. And it just has ripple effects up the chain, all the way up to the arm to throw, down to the ground, those type of things. So Lindsay, great question. I appreciate you asking. So let's jump into our next question. This comes from Justin, and he says, I'm a weekend warrior. So am I. Who likes to overdo things and usually pay for them later. What are your recommendations for recovering as a weekend warrior? Okay. Weekend warriors. So this is, well, let me I think the best way to answer this, Justin, is, well, let's put it this way. I do a fair amount of, so I work out during the week. I walk a lot. I'm going to answer this more personally, kind of what I do, because I've probably fit more of the category of a weekend warrior. And I don't know your age, I don't know how old you are, or general athletic, I don't know what you're doing. But the idea is, I can give you some general principles that I really like to follow. And myself, being a little bit of a weekend warrior myself. So let's do this. We're talking about recovering strategies. First and foremost, I can tell you right now, I can tell you when I'm not getting enough sleep. And it's not because I'm tracking it, but because how tired I feel in the morning. Basically my lifts, so when I start lifting weights or moving things around, things just feel a certain way. I just notice them a little bit. It's harder to lift, those type of things. So my first recovery strategy for every weekend warrior is you just need to sleep enough. Make sure you're getting good sleep. Make sure you're getting enough sleep. And if you're not, to be honest, it's the easiest, I shouldn't say it's the easiest, most simple thing you can do to improve overall health in almost every aspect of your overall health life. The sleep benefits, the benefits of good sleep are tremendous, and they affect everything. And so, as a weekend warrior, you need to sleep. And I've noticed when I don't sleep enough, things start to deteriorate fairly quickly until I'm either able to get back on a better sleep cycle, or I can either monitor my sleep and monitor my workload. So I decrease workload with my decreased sleep. It's not a linear relationship. So if my sleep goes down, I'm not dropping the same rate. I'm dropping it at a different rate, but just knowing what I have gone through in the past. So what I would suggest first, Justin, is monitor your sleep or find a way to understand how well you're sleeping, and then keep an eye on it. And I can tell you right now, time spent to organize your life a little bit, to sleep a little bit more, I think would be highly beneficial. Now I say that and struggle mightily myself with this, but then I also pay for it because I don't sleep enough sometimes. And I tell you that tongue-in-cheek in a lot of ways because I don't sleep enough as well, but I also understand that I take some significant offloading of my activities and because of when I don't sleep. So for instance, this past week, there were a couple nights where I was up really late and got up really early because we had some big projects coming around. And my workouts for that day were walking the dogs. I didn't pick up a weight. I didn't try to throw a backpack on. I'm in kind of a rucking phase right now in preparation for a few things. And I didn't throw a weight on my back. I just walked my dogs. That's all I did. And that was my workout. And I said, that's going to have to be good enough because my sleep cycle has been terrible. And that's what I did. So first thing, Justin, again, sleep. Monitor your sleep. See if you can either keep an eye on how much sleep you're getting. And then there's apps and all that kind of stuff. If you have a wearable device, you can use that and see if that'll give you quality sleep. But at this point, you need to at least have a pulse on how well you're sleeping and how much you're sleeping. That would be the first recovery strategy. Second thing, I can tell you that one of the biggest things or the better things that I've done just in the past probably month and a half is I've introduced an electrolyte pack or a powder to my water and my water intake. So I was drinking a lot of water. A lot of water is relative. I don't drink enough water. But the idea is I was drinking enough fluid per day, but the problem was I wasn't balancing it out in regards to electrolytes. And what I found was in the morning, if I drink a certain amount of fluid and I have the electrolyte packet, it's usually water with this powder, I know substantial improvement throughout the day. My body just seems to do better. And then I could tell you that I drink other things. I've got energy drinks. I definitely would tell you that I have an energy drink powder that I use that I like. I don't know if it adds anything to my recovery. If anything, there's a lot of vitamins in it, so I think that may be good. But it's just, that's kind of my fluid intake. But I would definitely say make sure you're hydrated, but really consider an electrolyte supplement that you can just throw into your drink. Those that don't like to drink plain water, this is a great way to make some flavor, but get some additional benefit rather than maybe some sweeteners or crystal lights or those kind of things that, maybe not as good. So consider looking at electrolyte powder. I can tell you right now that they range in regards to their pricing, and then also know that there is a substantial amount of sugar in a lot of them. So I don't want that. I went away from anything with sugar in it. I believe the one I take has stevia in it, and it doesn't seem to affect me negatively, and the taste is pretty good. 2 different flavors so far. I enjoy the blue raspberry more than the passion fruit as of right now, but that's been a big thing in regards to recovery for me, is some electrolyte packets or powders in my fluid intake. Other thing in Weekend Warrior recovery, this is something I actually told a friend of mine the other day who does a fair amount of rucking and hiking, is if you can find your way to a hot tub, I would do it. And I would just get in there and I'd just move my body around. It's not just so much the heat. The heat helps a lot, but get in there, move your body around, just get good movement in the hot tub, and then get out and keep walking and keep moving. That seems to help a lot of people. So hot tubs are a good idea. We do that with our athletes. We do hot bathing as well. Let's see. What else do we do here? So we can talk about nutrition. Nutrition is a big deal. You need to make sure you're eating well. I think the biggest thing I find with Weekend Warriors is they just have no idea. They have no idea how much they're taking in. They have no idea what they're taking in. They just know that they're eating, and they're probably not eating as well. So what I would probably tell you that would be the better benefit is to track it. Just track it. It's the hardest thing. I just started tracking calories and macros again about a month and a half ago in preparation for a few things. And what I've noticed is my food eating behavior has substantially changed just because I track it. And it's not because I'm like, oh my gosh, I'm eating terrible. It was more along the lines of like, wow, I don't eat enough. I found that, my wife nailed this like so many months ago. She's always telling me, you don't eat enough during a day. And I felt like I was like, I eat enough. And I started recording my calories, and I'm like, holy smokes, I don't eat enough at all. And so I've been eating more, and it's definitely been improving my overall energy levels throughout the given week. But I can tell you right now that if I go out and try to do a ruck, those rucks have gotten a lot better, and it has nothing to do. I ruck early in the morning, and I don't eat before. I just don't like it. I don't like the feeling in my stomach, and that usually means I'm living off of what I had the day before. And if I didn't eat enough the day before, that ruck, I feel it. I can tell you I feel it. And so the idea is, now that I started tracking, I don't have these big up days where I feel phenomenal with a pack on, and then I don't have these big down days where I'm like, holy smokes, we're barely going to get across this trail today. It seems to pan it out, and I have really not changed my diet outside of just tracking it. So, and maybe eating more, but yeah, that's about it. Justin, there's about 10, 20 different other answers, some fancy answers for you, but that we could give you. But realistically, it always comes down to this. And then any athletes listening to this, This applies to you 100%. These are the principles that we teach our athletes here at Athletic Potential. Look, first thing, get enough sleep. Second thing, make sure you hydrate well enough. Third thing, make sure you eat well enough. Okay, and then fourth, now we'll start talking about all the other fun things that you can do to try and improve your recovery abilities. So the fancy machines and the hot tubs and the bathing and all this, the things that we talk about, saunas, they're great things. But if you're not sleeping enough, you're not drinking enough, you're not eating enough, I think we leave the ability for those other things that we've barely talked about to really be effective. It just doesn't seem to work as well. So Justin, I kind of hope that helps. You're probably hoping for maybe some more cool, sexy answers than, sleep more, drink more, eat better. That's probably what I would say for weekend warriors. But yeah, so thanks for the question. All right, that does it for episode 24. As a review, just looking back, we talked about javelin thrower, and we had to make sure that we incorporated shoulder strengthening exercises in conjunction with kinetic chain linking and making sure that the body worked as one piece. Very, very important. We talked about low back pain in softballers and making sure that the pelvic position was where it needs to be, and to start in certain positions, specifically just standing and making sure they can find normal position, and then moving and doing different exercises, as mentioned before, planks and tall kneeling and those type of things, as it has an effect all the way up and down the chain. And then we just talked about recovery strategies and really the basics. Just making sure that you own the basics, the things that you do have substantial control over in regards to your sleep, your hydration, and your food intake. Get those things dialed in, and I think you're going to see the improvements in your athletic ability and your ability to achieve a little bit better in your athletic potential just by living to those principles. So, hey, I really appreciate everybody taking the time to listen to the podcast. We really enjoy doing these podcasts. Please rate and review, share with your friends. Make sure, if you have any comments or feedback, please send them to us. We want to make this podcast as good as we can for anybody. And if you have questions, that's what drives this podcast predominantly, is the questions from you. We appreciate you taking the time, and we'll catch you next time. Thanks.